Bronny James suffered cardiac arrest the other night while at practice, and in this video we're going to take a closer look at what this story means and what exactly could have happened. Welcome back everybody, I'm Dr. Brian Sutterer, and my goal in this channel is to help teach you more about the medical side of the world of sports. This is obviously a very serious story. Essentially, when someone goes into cardiac arrest, their heart has stopped beating, and they're essentially dead until somebody is able to revive them or resuscitate them. And so this is about as serious a situation as we can see in the world of sports. We of course all saw Damar Hamlin go into cardiac arrest on the field earlier this year, and so this has been a little bit more prevalent in the sports world of recent. This was the statement that was put out this morning saying yesterday while practicing, which is important here, Bronny James suffered a cardiac arrest. Medical staff was able to treat Bronny, take him to the hospital. He's now stable and no longer in the ICU. Number one important thing here when we talk about this is that he was practicing. So presumably there was some type of exertional component or something that happened around his athletics. It wasn't like he was just in bed at night and had cardiac arrest while he wasn't exerting himself. And so this sort of story of somebody having cardiac arrest or their heart stopping while practicing or doing their sport suggests, of course, more of these exertional sports types of causes of cardiac arrest. Outside of cardiac arrest, of course, our heart is beating normally. There's a conduction pathway where electrical signals are basically moving throughout the four chambers of the heart to govern the contraction of the heart to squeeze blood with oxygen throughout our body to supply all of our vital tissues. Cardiac arrest occurs whenever, for a variety of reasons, the heart stops beating. Cardiac meaning heart, and then arrest, stopping. This is different from a heart attack. A heart attack implies that there has been some blockage in the vessel supplying blood to the heart, like atherosclerosis or plaque buildup, that then cause, from a structural reason, the heart to then stop beating, as opposed to just cardiac arrest is a little bit more of a generic term, implying that something happened to cause the heart to stop beating. When the heart stops beating, you're essentially dead in that moment. Your heart's not beating and you need to be resuscitated, and that's where CPR comes into action. CPR stands for cardiopulmonary resuscitation, and essentially with CPR, what we're trying to do is through external means help to restore some blood flow from the heart to the lungs and then out to the rest of the body by pressing on the front of the chest with repetitive chest compressions. Oftentimes though, what we really have to do is defibrillate or shock the heart. When we defibrillate the heart, we apply these pads to the outside of the chest. We apply an electrical current that then travels through this whole conduction pathway to basically allow the heart to restart. It's kind of like restarting your car when the battery dies. You have to apply this initial sort of jolt of electricity to get the heart to restart into a proper beating pattern where it's able to contract. The way that we determine if someone's in cardiac arrest is, of course, just by initially checking for a pulse. When someone's in cardiac arrest, the heart might still display some electrical activity or something called an arrhythmia, but the heart isn't able to squeeze or pump blood. And so whenever we check for a pulse, we won't be able to feel a pulse, and that suggests that somebody's in cardiac arrest and we need to begin CPR. Time is extremely critical though, and so like we saw with Damar Hamlin, what matters is the fastest you're able to get somebody a defibrillator and get them shocked and resuscitated. Don't know the details of that with Bronny here, but hopefully, and I'm sure they would have had an AED or a defibrillator on site there at USC to hopefully apply the pads, shock if needed there on site at USC, and then quickly get them to the hospital for further evaluation. Now, once somebody's stable and they've been resuscitated from their cardiac arrest episode, the next and most crucial step is trying to learn about what exactly happens that we can prevent it from happening again in the future. We'll talk about all those potential causes, but first I want to give a quick shout out to the sponsor of this video. Sponsors help support the channel, so I appreciate you checking them out. This video is sponsored by Tommy John. Tommy John is a clothing company that offers some of the most comfortable fabrics and fits that I've ever tried. You've probably heard about their amazing underwear, but they've expanded out with offerings to fill up your entire wardrobe. Simply put, Tommy John's fabrics are unlike anything I've ever tried, and they're absolutely perfect for these hot summer months. Their cool cotton keeps you 3 times cooler than regular cotton and is more breathable. I've got some of their Apollo briefs, which keep you up to 7 degrees cooler than traditional cotton. It's gonna help pull perspiration and allow for better airflow, which are 2 things you definitely want more of during these hot summer months. They offer loungewear, sleepwear, things that are just perfect for when you're relaxing and lounging around the house and wanna be nice and comfy. And they even offer polo shirts. I'm wearing one of them right now. They're some of the most lightweight, just breathable, comfortable polo shirts I've ever worn. Right now, if you click the link in the description box and use my code BRIANMD3 or just scan the QR code on screen, you're gonna get 25% off your purchase plus free shipping on orders within the US over $75. Sponsors help make it possible for me to keep making videos, so by supporting Tommy John, you're also helping to support my channel. Trust me when I say you will not be disappointed with how comfortable Tommy John's clothing is. So thank you again to Tommy John for sponsoring the video, and let's get back to our learning. When we look at the causes of cardiac arrest, specifically in athletes, there are a couple of general categories that we divide things into. The first is things that are congenital or genetic, meaning you were born with them, you had them from birth, you didn't develop them later in life. The second category are things that are acquired, meaning infections like myocarditis, things like Kawasaki disease when you're really little, or things like we saw with Damar Hamlin with commotio cordis, where something happens to an otherwise normal heart. These acquired heart diseases can then be further divided into a structurally abnormal heart or a structurally normal heart. A structurally normal heart means there was nothing wrong with the vessels. There was nothing in terms of coronary artery disease or plaque buildup. The heart, electrical activity and structural function was completely normal, but then something happened. This is the category where we would put commotio cordis, what happened with Damar Hamlin, where something strikes the front of the chest. This impact happens at just the right time point in the cardiac cycle or the EKG, which causes your heart to go into an oftentimes fatal arrhythmia. Substances and environmental factors can also induce some arrhythmias that lead into cardiac arrest. So these can again fit into that acquired but structurally normal heart. The acquired but structurally abnormal heart is where we see things like atherosclerosis, things that will lead to your classically understood heart attack. This is also where we'd see acquired infections, things like myocarditis, that can all lead to cardiac arrest. The bigger category though, specifically within athletes, is the congenital. These are what we often see whenever we're talking about athletes who sustain sudden cardiac arrest. These again can be divided into the structurally normal heart or the structurally abnormal heart. Another way to think of it is somebody who has structural heart problems or electrical heart problems. The first and most common cause of actual sudden cardiac death in athletes is something called hypertrophic cardiomyopathy. Hypertrophic meaning big or more, and then cardiomyopathy because it's something that damages the heart. This is the beating of a normal heart in terms of blood coming into the left ventricle, normal size to the left ventricle, it exits out to go up the aorta and then out to the rest of the body. When someone has hypertrophic cardiomyopathy, what happens is this septum, the muscle tissue here that divides the right ventricle from the left ventricle, becomes really thickened. It becomes hypertrophied. When it becomes hypertrophied, it starts to push on the rest of the structures of the heart, which can lead to impaired blood flow, which ultimately leads to development of an arrhythmia, and the arrhythmia is what triggers and causes the cardiac arrest. So this is something where the heart is structurally abnormal. There's extra heart muscle tissue in this septum here that you have to specifically target and treat. One of the treatments for this is to actually go in and do something called a myomectomy, where surgeons can actually remove this excessive amount of muscle in here to try and free up the space within the ventricle. But this is something that is congenital, meaning you have it from birth. It's not something that you acquire later on in life, but is the most common cause of sudden cardiac death in athletes. The way that we'll evaluate for something like this is sometimes we'll see changes on an EKG where there has been some evidence of a remote infarct or a low level of death to some of this heart tissue. But typically we're going to be doing an ultrasound to look at the septum here and also probably a cardiac MRI to get better detail of how thick this wall is leading to this outflow obstruction. One of the next most common causes of structural congenital heart disease that leads to cardiac arrest is anomalous coronary arteries. Within our heart, of course, the heart muscle itself has to get blood supply from the heart, which seems kind of counterintuitive. But the coronary arteries are the arteries that come off of the aorta and then travel down to supply blood flow to the rest of the heart muscle. There's a typical pattern where these coronary arteries will travel, but in an anomalous coronary artery disease, the arteries grow in an abnormal fashion, and they can grow in an abnormal fashion to where they're prone to getting pinched or squeezed off between other areas of the heart. This is infamously what Sharif O'Neal had, where he had these anomalous coronary arteries, where they had to go in and do surgery to basically reroute and move where that coronary artery was to restore normal blood flow to the heart. That's another thing that oftentimes we have to do higher level like cross-sectional imaging scans and not just ultrasound or an echo to look and see if there is an anomalous coronary artery, something that then usually requires surgery to fix. Another less common structural cause is something called an arrhythmogenic right ventricle, where the tissue within the right ventricle of the heart becomes abnormal in a way that predisposes you to developing arrhythmias. And then just general disease with the heart valves themselves or the aorta, things like Marfan syndrome, or conditions where you can have abnormalities with the valves through the heart that the blood is passing through from one chamber to the other, are other causes of structural problems that you're typically born with that can lead to cardiac arrest in athletes and need to be evaluated. Recall the next category then to evaluate for in terms of causes are the electrical ones, where the heart structurally looks normal, but there's something wrong with the wiring, so to speak, in the heart. Our heart is a muscle, and the muscle has to contract in a synchronized fashion to allow blood to flow from one chamber to the next in a proper manner so that the heart can squeeze blood successfully throughout the body. This whole system is controlled by conduction of electricity throughout the heart muscle. These yellow lines through here kind of represent the rough wiring diagram of the heart. The electrical signal originates up in the right atrium at the SA node, travels down to the AV node, in through the rest of the ventricles, and then out to the heart to squeeze and contract those muscles. And this conduction pathway is also occurring on a cellular level, where one cell to the next has to be able to pass along that electrical signal to allow the sequential muscle fiber to contract. And so you can have electrical heart disease that is either on a bigger scale with these conduction pathways, or you can even have what we call like a channelopathy, where the individual ion channels within the heart cells are abnormal and impair the way that the electrical signal is being propagated and conducted through the heart. These conditions are things like Wolff-Parkinson-White, Brugada syndrome, congenital long QT syndrome, catecholaminergic polyventricular VTAC, things that again are causing this electrical conduction to be abnormal, which then causes the arrhythmias, which leads to the cardiac arrest. So big picture here, they thankfully were able to legitimately save Bronny's life. When somebody goes into cardiac arrest, that is, you need to intervene to save their life. And so point one here is just kudos to the medical staff that was there. I'm sure if this was an official USC practice, they would have had athletic trainers on site. They would have had first responders who presumably were able to administer CPR and legitimately save Bronny's life. Now the next stage comes, what exactly happened? Because it's not safe to let an athlete go back out and participate in sports after a cardiac arrest, especially if you don't know yet what happened. To evaluate what happened, they're going to look for, number one, was this something congenital or was this something acquired? They'll consider things like myocarditis. They'll then look at all of the congenital conditions. They'll look at the structural congenital conditions by doing things like echocardiograms, cardiac MRIs, maybe even a CT scan, and they'll look at the electrical causes of cardiac arrest by doing things like EKGs to monitor the electrical activity of the heart, stress tests where they put them on a treadmill, they exert them, and they watch and see if any arrhythmias are introduced in the heart function. And that will be how they determine what exactly caused the cardiac arrest. In a way, you almost hope that you discover a cause, because oftentimes if there's a cause, there is a way to at least manage it. Now, there are some causes of cardiac arrest that you find the exact cause, and it still isn't necessarily safe to return to sports because the risk is so high of having another cardiac arrest and potentially dying. Some of these conditions like hypertrophic cardiomyopathy or the anomalous coronary arteries like we saw Sharif O'Neal have can be treated or repaired best you can with surgical intervention, but obviously that's going to put Bronny out of playing for a really long time. It's hard to look at all this in perspective, but honestly, when an athlete has cardiac arrest, you kind of have to put their sports on the back burner because this is something that even outside of playing professional basketball, even just running around with his friends, playing pickup, exercising on his own, still makes him likely for having cardiac arrest again. And so you have to consider just intervening, discovering what happened so that somebody can have a safe and healthy life. The sports is sort of a secondary thing at this point that has to be an afterthought once they try and hopefully find what exactly caused this. The challenge becomes into play if they don't find an exact cause, then you don't really know what happened. You have to have that discussion of what exactly are the risks of going back out there and playing. Extremely serious situation we're dealing with, and legitimately something that could affect the rest of his career depending on what we discover and depending on what they have to do about it. My thoughts go out to Bronny and the rest of his family. Thankfully, they had good medical staff that were able to save his life. And I hope this video was educational to give you some information on what we look for when an athlete has had cardiac arrest. Let me know as always any questions or comments down below. And until next time, we'll see you later.